The University of Louisville is the premier dental school in North America when it comes to imaging technology. And the reason for that is that we have this very modern and unique radiology department. Currently, radiology is probably one of the hottest topics in dentistry. Digital imaging, where we moved away from films, but we also introduced back in 2004 a 3D imaging in dentistry. So the University of Louisville became one of the first institutions in the world to actually embrace 3D imaging in dentistry. And because of that, we've been pioneering the field in dentistry and help integrate imaging with different departments. With the leadership of Dr. Scarf, we have written many books, many articles, and currently those articles are the most quoted in the literature, in the dental literature worldwide. So the Department of Radiology from the University of Louisville is extremely influential on how every dental school in the world today uses imaging. Another thing that's very important to stress about the student experiences here at the University of Louisville is the fact that we have an amazing gamma of technology available to the students. We have currently about 9 CT scanners, dedicated CT scanners for multiple specialties that all students and faculty members of the school have access to. But it's not always about having access to the technology. You need to have the expertise about how to apply technology. Since we have 3 board-certified radiologists here in our department, we can dedicate time to train our students not only from the 2D imaging component, but also on the 3D imaging component. The University of Louisville last year made a huge investment in this particular philosophy of educating dentists with the latest technology, and what we were able to achieve to create what's called a dedicated 3D PACS for cone beam CT imaging. If a patient comes in and we acquire an image on that particular patient, that image can be distributed in any of the 1,400 computers that we have around the clinic. It becomes very easy to transfer information, to retrieve image, to manipulate images in any location, and that will allow for better access to care and better diagnosis on these patients that we're seeing here. We believe in hands-on activities, so from day one, the students are going to be coming to the clinic and they're going to be taking their own images with digital sensors, state-of-the-art digital sensors, state-of-the-art panoramic machines, and also 3D image machines. We train them how to do that. We think it's very important for students to have this hands-on activity. We have a dedicated course on 3D imaging and technology on the 4th year, where the students are going to be able to understand more about 3D imaging, but also understand all the applications related to advanced procedures in dentistry, such as implant planning. One of the things that also makes this particular environment very unique, it's not only the fact that we are working with 3D imaging itself, but we're also bringing 3D printing technologies to dentistry today, where we currently have 6 3D printers, a variety of softwares that allow students and residents to come to University of Louisville and plan advanced procedures on a computer, and with the push of a button, print surgical guides, 3D models. What is happening is allowing us to be more predictable in dentistry, to predict better outcomes for our patients, and to make treatment planning faster, better, cheaper. Our hope and our goal is for you to become a very competent general dentist. And by having early access to technology that is currently not even available in private practice, what that will allow you to do is to carry on principles and have knowledge that's not easily accessed for people that are actually in the private practice world. So the idea is that our students, as they come out, they will have this experiences related to digital imaging and digital technologies, and will allow them to flourish in the private practice world.